Okay, so my name is Dr. Philip Oob, and this is,
I'm Dr. Robert Whitfield, board-certified plastic surgeon in Austin.
and so we're going to talk a little bit about BodyTite or skin tightening. So Rob, why don't you start off first with telling us what is BodyTite?
Sure, over the last decade, I've always been asked by patients how to tighten their skin. There's been various products over the past decade that have been used with very little success until recently. In 2016, the FDA approved a product from InMode called BodyTite and FaceTite. In this country, its only ability is to do radiofrequency treatments without liposuction. In other countries, it has a liposuction function as well. So the technology is very interesting. It allows, and we're going to look at the probe, the lower portion goes underneath the skin through a small, essentially like IV stick, and then the upper portion glides across the top of the skin. It has two temperature sensors, one in this tip and one in this tip, to help give feedback to the machine as it heats.
Okay.
So it heats underneath the skin and above the skin. The heating underneath the skin or in the subdermal plane allows it to tighten from beneath, and then you're heating from above and tightening it there as well. You also can actually hear the fat as it liquefies, and then you can suction
You can hear the fat as it liquefies.
It'll start to almost sizzle like bacon. So at that point, you'll see the thermal coupling happening on the machine, and you'll hear it.
Okay.
You heat the temperatures underneath to about 65 degrees, and on the top, according to the input in the machine, about 38.5. And then we use an infrared camera to look at it, and sometimes it'll reach close to 42 on the infrared camera. So that amount of thermal energy will treat and tighten the skin.
Okay, fascinating. So how does that actually work to tighten the skin? Like, what are the mechanics that create the skin tightening other than just heat?
It's just the heat. So if you're doing open surgery and you take skin off and you're looking at the dermis, the deeper layer of the skin, if you apply unidirectional or unipolar heat to it, it'll shrink right before your eyes. So it follows true that bipolar, which is two tips and the heat transmitting between the two tips, between these tips, it releases the energy between those tips and heats along the plane you're treating versus just touching skin in that area and heating it, which is what we do in the operating room. So it all follows the same logic that's been used many, many decades in the operating room for open surgery. That's why sometimes the simplest ideas make the most sense. It takes a long time to get something like this approved in our country. Obviously, safety and efficacy are very important. Lots of protection is built into the device, so you can't create a burn underneath the skin, because if you apply too much energy, whether it's above or below the skin, you can create a burn.
So the bacon won't get too crispy.
Correct.
So what areas can you treat with this thing? I know I've seen you do the sides.
I'm showing the small device, and this is what you would treat the face, or on somebody who's smaller, you can treat areas of the love handle region. For larger areas in both males and females, you use a larger probe to treat areas of the body, including the arms, the chest, the abdomen, the hip thigh region. So pretty much anywhere you can find skin laxity, the inner thigh region as well, you can treat that area. You can do it in isolation, so you're just heating and tightening the skin, or you can add heating and tightening plus liposuction to remove extra fat and get more contraction of the skin around the area where you've taken the fat out.
So when you say the face, do you mean the whole face or just the neck?
You can use this small probe to treat the entire face. The neck's the easiest to do under local, just as a simple office procedure.
Simple office. That sounds a lot more complicated than my simple office procedures. So how is this device different from some of the other products on the market, and why did you choose this product?
So previous devices just had unipolar, so just the lower portion. So it'd just be like sticking that underneath the skin and releasing energy out the tip. So the problem with that is that the energy would disperse through the tissue and not focally treat an area and give you uniform heating across the entire area. Because this is bipolar, two limbs, it treats between the two tips, so you're always controlling where you're heating, where you're passing.
Did the other devices just stay on top of the skin, or they were always underneath? Okay, so this one does both on top and underneath.
Correct, yeah. So each of the other products had different options for external heating, but not at the same time. So this allows you to heat both beneath the skin and above the skin at the same time. So your treatment areas can be brought up to temperature uniformly, both above and below the skin.
Okay, so it sounds pretty safe. What's the downtime for people? How long does it take to recover from something like this?
So if you do it in isolation, you're going to have swelling 1 to 2 weeks. If you do it in combination with any kind of liposuction procedure where you're removing fat, you'll get more swelling and inflammation. So I use compression to treat swelling and inflammation, and then I rely on you to help me medically not have too much swelling and inflammation. So maybe we could talk about how to reduce that.
Okay, so I frequently use supplements and diet to improve inflammation, and certainly you want to try to start some of this stuff before the surgery, because trying to do it after the surgery can be a little difficult. We frequently use fish oil, curcumin, CBD oil, and then something called SPM Active, which is made by Metagenics. It's actually the components of fish oil that actually are specifically the ones that turn off inflammation. We call these pro-resolving mediators, or the scientists call them pro-resolving mediators. So this SPM Active is very focused at reducing inflammation, especially after a surgery or something like that. You have to be careful. You have to talk to your surgeon before you start taking fish oils and stuff. They don't like a lot of bleeding.
So we're going to talk about not using fish oil before surgery. So obviously for us, when we're doing closed procedures like this is really just an isolated, no more than an IV stick to put this in. So having taken fish oil in this setting for this isolation procedure is not as big of an issue. But if I'm going to combine it with liposuction, then absolutely we take people off the supplements that will limit the clotting process, and this one does. It inhibits some of the ability of platelets functioning properly in the beginning of the clotting cascade. So after surgery, that would be appropriate to treat swelling and inflammation.
Very cool. Well, one more thing I would like to add as far as skin tightening is frequently postmenopausal women don't know about hormone replacement, and the hormone replacement can help with actually skin rejuvenation and putting kind of fluid in the skin. As many women know, if you go through menopause or see other women go through menopause and they're not doing hormones after menopause, they age much faster. So hormones, or estrogen specifically for females, give the skin a lot of integrity and can improve the skin texture just based on the hormone replacement. So look at all your options to improve your skin function, not just using bipolar, not just using hormones. It's really using it all to make it look better. Okay. Well, thank you, Dr. Whitfield. I appreciate the advice.
All right.
And if you want to come to our open house event, it's November 14th from 4 to 7 o'clock. We'll have dinner, drinks. Come on and join us.